Actually, this hospital was established by the Dominican Sisters of Spire in July 1916. 6 of these young sisters came all the way from Germany through the auspices of the then Accra diocese, Bishop Bowers at the time, whom the chief of this town had gone to see and requested that just as he had brought some German nurses to Bator in Accra diocese, he should also bring some of them here. So the sisters came down to start a very small clinic. In fact, there were only 2 rooms at the time, 2 rooms of 6, call it wards. And it was a community clinic. So when the chief had prevailed upon the bishop, they converted it into a Catholic institution. And this is how come, gradually with time, it has become St. Dominic Hospital. It is St. Dominic Hospital precisely also because the Dominican sisters, were those who first started the work here. And by and large, St. Dominic Hospital has grown into a very huge facility. As we speak, it is a regional hospital accredited by NHIS. And what I mean by regional hospital is a secondary level hospital. And a secondary level hospital simply means that it offers specific specialized services. In other words, primary facilities refer cases to this hospital. And the primary facilities that refer cases here, we are talking about Achimoda, Brim Central Hospital, Government Hospital. We are talking about Simankasi Government Hospital. We are talking about Kede Government Hospital. We are talking about Achim Swedro, and all other facilities around this enclave. In fact, the population target of St. Dominic Hospital, or the target group that St. Dominic Hospital sees, is in excess of 100,000. Population. So it actually goes far and wide to take care of people from all walks of life. People come all the way from the northern region to visit St. Dominic Hospital precisely because of the specialized services sometimes, in that area, call it urology, that we offer. We don't have a resident urologist here, but we have a partnership with a group in Germany, so they come from time to time, and 3 times each year they come. And this is why people come all the way from the northern region to visit St. Dominic Hospital.
My name is Maite Alfonso Romero. I'm the medical director of St. Dominic Hospital, Akwatia. I'm also a family medicine specialist and public health. Here in St. Dominic Hospital, we run a series of medical departments. We have internal medicine department, pediatric department, obstetric and gynecology departments, surgical department, children ward, palliative care, fever units, nutrition, PNTCT and HIV counseling units, laboratory, radiology, and OPD in general. We also run different clinics. We run the diabetes and hypertension clinic from Monday to Friday. We run neurology clinic that is done on Tuesdays. We run a specialist clinic that we run during the whole week. We also have other clinics like otorrino and laryngology clinic. And so we also have a department of stroke units run directly by this specialty. We have ophthalmology, that also runs what is the OPD clinic and the surgical sites. All these have been supporting with services, diagnostic services, that is CT scan, ultrasound, ECG, endoscopy, cervical cancer and prevention units, PNTCT, and a well-defined and certain laboratory.
As you are already aware, the medical director spoke about the various specialties that we have. I mean, the four major, blocks in, the medical field are all covered. I'm talking about surgery, I'm talking about medicine, I'm talking about pediatrics, and I'm talking about ONG. And so we also train, house officers here. And we have all these specialists at posts here at St. Dominic.
I'm Dr. Foster Osei-Poku. I work in the Department of Medicine. I'm a senior physician specialist and a neurologist. We basically take care of all diseases that affect adults, and these days the cutoff age is 12 years and above. That does not require surgery or is not a gynecological problem or pregnancy related problem. So basically, yes, we see all persons above the age of 12 with various medical conditions that usually do not require surgery. St. Dominic's Hospital is one of the best places, to seek healthcare. It is equipped with all the specialties in medicine, from pediatrics to internal medicine to general surgery to obstetrics and gynecology. We've got a dental unit, we've got an eye clinic. So it's a one-stop shop. I mean, once you enter St. Dominic's Hospital, we have a solution to your problems. We have the patient at heart, and we do basically everything within our power to give our patients the best of care and the best outcomes they seek.
Hello, my name is Samuel Atenka. I'm a dentist at St. Dominic's Hospital, head of dental unit. In the dental unit, we offer so many services like extractions, cleanings, root canals, whitening, fillings, so much. And you are entreated to come to St. Dominic's to visit us because we have one of the best equipments. Our charges are affordable, but quality. We also accept National Health Insurance Scheme.
My name is Dr. Frank Esiedue-Eboa, an optometrist at the eye clinic of the St. Dominic's Hospital. The eye clinic is dedicated to the care of the eye, from consultation, surgical to optical services, and rehabilitation. We have a whole range of all the professionals, an ophthalmologist, optometrists, ophthalmic nurses, and opticians, among others. The unit usually runs from Monday to Fridays, but weekends we have people on standby for emergencies. We dedicate Tuesdays and Thursdays for surgical and outreach services to the communities around. We recently acquired an optical coherence tomography, a machine which is standard in modern eye care. Do not pass by us, pass by for the best of services.
My name is Dr. John Kwame Nabusumtwi, specialist obstetrician gynecologist with St. Dominic Hospital, located in Akwatia, in the Denchembo district of the Eastern region. I work with a brilliant team of doctors, young doctors and midwives in the provision of obstetric care, which encompasses antenatal, labor and labor-related services and postnatal services, coordinated with child welfare services, as well as gynecological services, which encompasses well-woman care and some aspect of fertility care for clients. This young group of exuberant, enthusiastic professionals do their best to give care to all and sundry, irrespective of race, irrespective of religion, irrespective of denomination, irrespective of social standing. And our aim is to be a standard, especially in this part of Ghana, to be regarded as one of the best when it comes to obstetrics and gynecological care services or provision of services in that field for people. We've had patients coming from far and near with a lot of success stories. To buttress the point, I would encourage everyone to patronize our services, because we offer you nothing but the best. We do our best to give you patient-centered, patient-focused care to get the best results that your money, your time, and your situation can afford. I would like to use this opportunity once again to encourage everybody to patronize our services, and I am sure that you will not regret utilizing our services.
And there's one unique thing about St. Dominic Hospital. Because of our mission statement, which I would encapsulate this in two major words: efficiency and effectiveness of service to serve our clients, the patients. We really focus all our attention on satisfying the expectations of our clients. And so when people come here, they really feel at home. Eventually they get satisfied and tell the story. You may have the chance to speak to one or two of our clients and they will tell you the story. We respect our clients so well, and we share with them the processes of healthcare. They give us their feedback and we try to work upon it, call it the improvement plan.
I'm Mavis Apiji, the nurse in charge for the kids units or the pediatric units. At the pediatric units, we render both medical and surgical services. We receive referral cases as well as seeing cases around our environment. We're receiving referral cases from Asamankese, Oda, and its environs. The kid ward has 3 sections. We have the kids OPD, the general ward, and NICU. At the kids OPD, we run different clinics. We give general OPD care as well as special clinics like NICU clinic, asthmatic clinic, sickle cell clinic, and others. At kids OPD, we give a very prompt care as our nurses practice effective triaging system. In the units, we stand on our own because we see ourselves as a hospital within the hospital, because we have our own OPD, our own general ward, plus our intensive care units. So we sometimes receive emergency cases straight to be nursed in the units. We assure you of prompt and better care because we don't delay in our services.
My name is Charlotte Owusu-Ansah. I'm working at the emergency unit and I'm the nurse in charge of the units. But when you come to the emergency units, we treat all emergencies. medical, surgical, gynecological, pediatric, mental cases. We have competent nurses who are trained very well to receive you and take care of you. We also have doctors who run the shifts. We have permanent doctors for the day shifts and also the night shifts. So anytime you come to the emergency unit, you have a doctor to see you. We also have all equipment needed to monitor patients so that they will receive their prompt and immediate care.
My name is Ahiakuluku Stonam. I am the perioperative nurse in charge of the main operating theatre of the St. Dominic's Hospital. At the theatre, we offer surgical needs to the clients that need it. We offer obstetric care, gynecological care, and general surgery needs to those who need it. Our main aim is to provide safe surgeries that saves life. We offer emergency and elective surgeries. When you are booked for the operating theatre, the ward where you are prepares you adequately. When it is time for the surgery to be done, we call the ward to bring you to the operating theatre. You are received warmly and made comfortable whilst you wait for your time to go into surgery. When it is time for surgery, you are sent into the operating room and the surgery is done when all checks have been done. In St. Dominic's Hospital Theatre, our main focus is your dignity and your safety. And so I encourage everyone who needs surgical care to look nowhere but to St. Dominic's Hospital, where I assure you that you will not be disappointed. Because at St. Dominic's Hospital, our main aim is to offer high quality care that enhances life and excels in care. My name is Nancy Chief of Akwatia, the in charge at the ICU department of St. Dominic's Hospital. What we do at the ICU basically is taking care of patients who are critically ill, patients who have undergone intense surgery that need respiratory support. So when the patient comes, we put the patient on the ventilator to support the patient so the patient can breathe for him or herself.
You can't talk about St. Dominic Hospital without talking about these specialties. And I have to tell you, our specialists are of a kind. You have spoken with some of them and you understand what I mean. When you talk about ONG, for instance, across the board, this area, we are the best. Medicine, we are the best. Pediatricians, you know, we have at post are simply awesome. They have the love for the kids, and surgery the same. Okay, so we have additional tax to it, which the rest do not have. Radiology, we have CT scan here. The whole of the region, I think currently Eastern region, this is the only place which has its CT scan running, and we have a radiologist, you know, at post. We do a number of, you know, call it diagnostic services at the radiology department as well. And so when you look at it from that angle, you see the services we render to the population. In terms of human resources, St. Dominic hosts a total staff population of 788 as we speak. Majority of them are nurses. They take the chunk of the number. The other supporting staff also are quite many. Then I think that the fewer group or the smaller group is the prescribers, and they are in excess of almost 50 apartments. It's amazing. It's a whole village in itself, and the hospital sits on a 73-acre land. You know, so you have a village in itself here, and we provide accommodation for more than 100 of our staff. And this should tell you the vision that our forebears had, and for which they did everything they could to make St. Dominic what it is today. I mean, we took over since 2017, and when we took over, it was still a primary institution. But thanks to God, who has blessed us with all the wisdom probably that we could be endowed with the professionals we have at post, we've managed to do all or to meet all the requirements by our regulators, all the regulatory agencies, and NHIS recently accredited us the secondary level institution, although HEFRA had accredited us since 2019. I have to mention that I don't work alone. I work with a formidable team of managers, and these are professionals. I respect them, and I must say I have so much, honor for them. When we have met as a team, we are 7, each coming from his or her professional background, and when they table their contributions, you see that professionalism coming to bear. They make my work a bit more easier because they contribute to make you understand what we can do together. And I must say that together with them, that's how far we have come as an institution within these 5 years.
I'm Mrs. Anita Osei-Tufo, head of the nursing department. I'm a DDNS, but I'm an ophthalmic nurse by profession, and we are numbered around 292. I'll urge our clients to come when they have issues, when they have concerns, when they are not feeling well. They should come. We should come so that at least we have the best things to work with as a facility, so that at least they will be able to meet. It will be able to meet their expectations. We have all the specialty areas whereby you have to travel elsewhere to go and get. We have, if it's beyond that, at least we have people that we know that we can call, or we can refer you to maybe continue with the care. But whilst we are here or wherever you are, if you want to assess eye care or eye health, should I put it, ENT, neurospecialist, maternity, and all those things, dental clinic, we also have all those things available, so that if you want to have your body examined for any challenge, please, you can come. Doors are open 24/7, so that at least the services that you need will be rendered perfectly for you, so that you also feel at home. And the one most interesting part is when clients complain, or when clients say she's not satisfied, we ask clients, what is the actual thing that made you not to be satisfied? And then we see how best we can amend and improve upon the services that are rendered. So I think this is one of the best facilities that if you need help, you need anything that concerning your health, when you come, I think you'll be satisfied with the services that will be rendered to you. So St. Dominic's, yes, we at least, if not the best, we are among the best in rating.
My name is Evelyn Amoako. I work as the Deputy Head of Nursing Services at St. Dominic Hospital, and also the Head of the Public Health Unit at St. Dominic Hospital. With my work as the Head of the Public Health Unit, what I do is to coordinate the work of various sub-units made up of nutrition, antenatal, reproductive and child health, the HIV clinic, the counseling unit, the lifestyle clinic, the cervical cancer screening center, as well as outreach activities in the hospital.
I'm Mary Ode Amwako, Deputy Antenatal Clinic in charge. The antenatal clinic, we offer services to pregnant women and postnatal mothers. We try as much as possible to enhance the life of our pregnant women and then excel in the care we give to them, as the motto of the hospital says.
I'm Eunice Bedu, maternity in charge at St. Dominic's Hospital. At our department, we take care of prenatal women, that is before delivery, and postnatal women, that is after delivery. Before a patient or a pregnant woman can be sent to labor ward, she is first admitted at our department for assessment to be done. So if we see that the patient is in active phase of labor, that is from 4 cm, we transfer the woman to the labor ward.
My name is Cynthia Sechere Bruku. I am the deputy in charge at the labor ward. We take care of laboring women who are in active phases. When you come to the labor ward, we have the first stage room, the second stage room, and the third stage room. When a woman comes in labor, we examine and see if she is in the active phase. If you are not yet in the active phase, we send you to the maternity ward. They will do the monitoring till you get to the active stage. Then they bring you to the labor ward and they will take care of you from that point. We have a very competent midwives who will take care of you, monitor you, and deliver you of your babies. We are encouraging everybody to come to St. Dominic Hospital to deliver. You are safe in our hands.
I'm Paulina Agoso, working at St. Dominic's Hospital, Akwatia, RCH in charge. Our main work at the unit is to cater for children born from day 1 up to 5 years. Our focus again is to vaccinate all children under 5 to protect them against the 5-in-1 childhood illness. Alongside, we also check the growth monitoring to see if really our children, our babies are growing well.
With Ankuma is my name. I'm a public health nurse and the in charge at the Lifestyle Clinic. The Lifestyle Clinic is a special clinic that seeks to provide quality care to patients diagnosed of diabetes and hypertension. The goal of the clinic is to ensure better management outcome of patients diagnosed of diabetes and hypertension, i.e. to get their blood pressure levels control as well as their blood glucose level control.
I would want to recommend to everyone listening that is in our catchment area or even beyond. Our pricing is unique. Although we offer specialized services, we charge like a primary institution. It's all because of the frontiers of the facility. We know our people and we are always conscious of, call it the 4 P's when we are dealing with pricing. We look at the people that we are serving, we are looking at the product, we are looking at the place, and we are actually looking at the environment within which all these are taking place. So it is our competitive edge, the quality of services we have, and the pricing so low to meet the standards of our people. Beyond that, we also have people who have Christ at their hearts. Catholic, a core of our work. The core values we work with, it's all around us. God-fearing is number 1. Honesty, confidentiality, professionalism, supportiveness, and around all these, you find people who are so committed to put them into practice.
My name is Henrietta Datson. I'm working at the St. Dominic's Hospital. I'm the OPD in charge. OPD is the gateway to the hospital. So everyone who comes to the hospital comes here first. Here we run a number of services. We have the general, the gynae, the specialist, the neuro, and the physician. This place is a very conducive place. Everything is intact. We are environmental friendly. The nurses here communicate well. We respect people. Confidentiality is number 1. We don't
communicate other people's illness to our relative or other people. Everybody should come here for treatment and the person will be well.
My name is Daniel N.K. Mensah. I'm a biomedical engineer, and then I'm the head of biomedical engineering unit in St. Dominic Hospital. In the biomedical engineering unit, we ensure that all the medical equipment and non-medical equipment are serviced, maintained, repaired to its optimal use. That means they are calibrated and they are tested to ensure that all the equipment are ready to use at any given time the nurses and the doctors would need them. I will entreat everybody who wants to come to St. Dominic's to make it a point and visit St. Dominic Hospital, because we have equipment to take care of the patient.
My name is Engineer Bernard Daxon, the head of estate and maintenance of St. Dominic's Hospital. My core mandates include maintenance of hospital structures and residential bungalows, construction of new projects or buildings, and also to ensure that the hospital compound is well kept.
I am Gifty Dagba, the head of stores of the St. Dominic Hospital. St. Dominic Hospital has 5 various stores within the facility. These are the medical and surgical store, the pharmacy store, the optical store, the maintenance store, and the mini-mart store. These stores take care of the needs of both the patients and the staffs as well, as the name of the stores depicts. So we take care of the consumables, the drugs, and everything that is required in giving healthcare delivery.
Quinoti Emmanuel Ado, working at St. Dominic's Hospital Mortuary as in charge. Mortuary is the place where dead bodies are kept to their removal. The hospital morgue can take about 400 bodies. As at now, the place is empty and is one of the best mortuary in Eastern region that people use to praise our services that we offer to them.
What next we envisage for St. Dominic Hospital? You know, already St. Dominic Hospital is a training institution. We train doctors. They do their house jobs here. And of course, we train nurses. We train other, supporting staffs by way of them coming for their internship and all that here. But we, after this level of secondary facility, want to inch into a training institution. So the essence of seeking to put up a training institution, which is a physician assistant school, is twin in nature, to build that gap of human resource of prescribers, and also to forestall staff attrition of prescribers. 2 years from now, hopefully, we should have, the project is almost done, the building is almost, it's inching into the completion stage, and we should be done by next year, latest by close of next year, it should be done. Then the paperwork and all others will take off from there. So latest by 2025, we should have our physician assistant school running right here at St. Dominic Hospital. So I want to say St. Dominic Hospital, it's a very good Catholic institution thanks to our forebears, and currently the owner is Most Reverend Joseph Afrifa Ajekum. He's the trustee of the institution, and we work to bring the hospital to the levels that we hope one day we shall all be satisfied and proud of.
St. Dominic Hospital,
enhancing life and excelling in care.
I say thank you for this great interview, and God bless you.